Welcome to the Healthcare Uncomplicated YouTube channel. Today I have another magnificent leader and guest for you. But before I go ahead, make sure you subscribe to the channel. Check all the previous content. Is a lot of amazing content there for you. But let me introduce the speaker today and my guest. For 8 years, Glen Gilmore served on the board of directors of a university hospital while serving as a US mayor for a city of nearly 90,000. While serving as a mayor, Glen called a man of action by the Time magazine and a national hero by the New York Times for establishing an emergency medical response to America's Anthrax crisis. Glen is also a lawyer and a founding faculty member of the Rutgers School of Business Digital Marketing program, where he created and provided instruction relating to healthcare marketing, privacy, and emerging technologies. Glen, delighted to have you here. How are you?
I'm terrific and very happy to be on your show here today. Thank you.
Brilliant. So, Glen, the topic that we are discussing today is healthcare in the metaverse. And let's start with the basics. What do you mean by the metaverse?
When we talk about the metaverse, we talk about an immersive digital experience. Very frequently, we think of a device like this that lets us, when we put it on, enter a world, a digital world that when we look up, we see the sky. When we look around, we see other people. It's an experience that takes us away from this two-dimensional screen that we've so become accustomed to and allows us to actually walk in a space. And so the beauty of it is, through digital twins in particular, we can now have replicas of hospitals, healthcare centers, where you and I can meet and really feel as if we're in the same place together and do some pretty exciting things together.
Brilliant. Fantastic. And why is the metaverse so exciting for the healthcare industry?
It's really about taking telemedicine and moving it to an incredible level where you can have training. For example, the University of Purdue, their nursing school is doing some excellent programs where they'll have an operating room and they'll have nursing students come in or nurses who are updating their training. You have a patient in front of you and you really have a sense as if you're doing actual procedures on a patient, but it's safe. It can be updated. It can be accessed around the clock. And it's a way to leverage healthcare so that healthcare training or healthcare information can be accessible around the globe so that we have the best medical care for the best opportunities when we need it, where we need it.
Sure, fantastic. That's really a major groundbreaking thing, being present at the room whilst we're not there. So and technology enables us to do that. I know you've been working with emerging technologies for quite some time. Do you think this is one of the biggest, let's say, biggest things in healthcare happening in the future?
It is. It's a game changer. We've seen through the Internet of Things and through virtual reality, remote operations taking place. When suddenly, though, you can have with virtual reality this immersive experience where you can invite a lot more people to the process, learning happens much faster. Statistically, we know that virtual reality training is more effective than even training in a classroom that's with other people in real life. For some reason, there is this ability to have a little more comfort in that process of virtual reality education. So it's going to really, I think, make healthcare much more accessible. I had an opportunity to be on a panel with a minister from Singapore. Interestingly, she made the point that for their community in Singapore, an older community, they believe that virtual reality, the metaverse, will make healthcare more accessible because people who have mobility issues will be able to feel as if they're at a doctor's office and get vital information in a much more meaningful, immersive experience.
Oh, fantastic! That's really great. And moving on, Glenn, what do you think needs to happen to make the metaverse a more likely venue for telehealth?
The devices have got to become more affordable. And also, I should point out this is Google Glass. When
Hmm.
it was in beta, it was about this size. So people who look at this and say, "Well, that's too heavy," and say, "I'm not going to wear that for an hour, or let alone 15 minutes." Well, this is what I think the future of it will be. It will become much more streamlined, much more affordable. We in healthcare understand how important privacy is, and there's a big hurdle that healthcare has to uh, make to make sure that patient information is safe in the metaverse. That's going to be a big challenge. But I have no doubt with all the great minds that are working on this right now, we'll find a way to do that, but it will be an ongoing process.
Brilliant. Glenn, a big issue around the world is always like who pays for it. I mean, I'm a big advocate and fan of wearables and the medical devices and smart devices. And there's always this crucial issue. We see the value of the devices, bringing the data and bringing everything together in healthcare, and also enabling the patient and the human being to start taking responsibility about their own health. There's always this issue around who is gonna pay for it. How do you think we can perhaps solve that issue or work around it?
I appreciate that question because it's about the digital divide. It's about access to healthcare. We can't just have another gap take place because there's another cost prohibitive technology that's involved. We had a point in time in which people asked, well, who can afford a smartphone? Everyone has a smartphone. Who can afford a device like this when probably it doesn't cost all that much to make, but there is a profit margin that goes into it? As we have more competition in the field, I believe that we're going to find that this wearable of a device that has mixed reality, augmented reality, virtual reality will become much more affordable. And when it does, we'll have that access. Until that occurs, though, I think we need public-private partnerships to make sure that people everywhere, regardless of income, have an ability to access virtual reality in the metaverse because it's too important for them not to.
Yeah, fantastic. Glenn, would you like, before we wrap up, I mean, it's so many things in here to consider. We could talk for a long, long time. Is anything that you want to add around virtual reality or mixed reality or augmented reality or anything that you want to bring to the
Sure,
equation
sure,
before we wrap up?
sure. Sure. People have got to understand when we talk about, for example, the phrase digital twins, what we're talking about is an ability to make replicas of places. And so it moves virtual reality from being thought of as something for gaming to something for business, for something for healthcare that allows us to have accuracy and security and collaboration. And I think it will be a great place for us to collaborate together, to learn together, and to make healthcare more accessible and better in the process.
Brilliant. And that, in a nutshell, that's what healthcare needs is a stronger links between people, connectivity and collaboration, bringing all the ingredients together. Glenn, it's really
Absolutely.
nice. It's really nice to see you. Thank you so much for
Likewise.
accepting my invite
Well, thank you.
and being here on the show. Before I wrap up, I'm very grateful. Thank you so much. Before I wrap up, I have a very. It's not really a question as such. I'm expecting a short answer.
Okay.
How can we make healthcare uncomplicated?
By asking questions. By asking questions. I think that's the way we do it. And fortunately, a show like yours helps because you have so many diverse topics, and I appreciate that. So you're part of the answer. And for those who use healthcare, all of us, we've got to ask more questions. And thankfully, we have you helping provide some answers.
Brilliant, Glenn. I love that answer. So simple. That's what healthcare needs in a nutshell. Simplicity.
It does indeed. It does indeed.
Glenn, thank you so much for being
My
here
pleasure.
again. I'm gonna wrap up to all our viewers and listeners. Make sure you subscribe to the channel. Also, I'm gonna post Glen's socials in here, his LinkedIn and his Twitter. He's very active and he knows this stuff. So connect with him, ask him questions about healthcare or further afield, and I'll see you all next time.